Hi everyone, good morning. Hope you are doing really well. It's fantastic. I'm super excited about sharing Mary's case here, this gasket denture. Um, because if you're not doing gasket dentures, then you're in for a treat because these work beautifully. So, um, as always, and Colin has joined us already. We've got the Q&A box here. I can see that. So if you've got any questions throughout this webinar, please just pop them in that box, please. So I've had a wonderful month actually. It's been great. A whole combination of stuff. This is a meeting that I was at last weekend. This is the Besford Study Club. We're in a club that's we love dentures, absolutely love them, all of us. And John Besford has been my mentor for years, and we invited Charlotte Stillwell back to do a couple of days, as well as John Wibberley. He came, he's a dental technician too, and he spoke for half a day. And they really just gave us their experience over years of working in dentistry. It was wonderful. I've also run a complete denture course as well since I last saw you, which was great. And also, I do a lot of mentoring. I love this one-to-one mentoring. And I'm super excited because I've got an American chap, John, here from Texas, who's visited me twice now. And he came to the Bestford Study Club as a guest. And that was a wonderful thing. But it's just so thrilling now that the world is so much smaller and communication is so quick. It's wonderful. So he popped up to the practice and he saw me treat a patient this week, and it's been a wonderful thing. And he's gone away. So, and then I'm doing my clinical work too. It's just been great. So, I'm really just enjoying my dentistry and teaching. It's just lovely. So, this is let's crack on with Mary now. So this is Mary, lovely person. This is what we did. We took her from that to that, copying her smile. Um, this is what she loves doing. She's based up in Cumbria, which is just north of here. It's very rural, beautiful countryside, mountains and lakes and things. And she breeds these really beautiful sheep, and that's what she does for a living. Um, so she's a farmer. Now she came to see me because she was referred by her cousin, who was a dentist, and she specifically came to see me because she doesn't want implants. So patients are really, now that other dentists know that this is what I do is focus on dentures, they're referred to me and self-selected out really for that. She's 72. Let's have a look in the mouth here. So this is without the dentures. There's a failing bridge here. It's stuck on that first molar just there. And then there's a few roots, and I could see a few areas and things and draining sinus here between these two roots there. She was wearing this. This is a complete upper denture, and she's worn it over time, hasn't she? You can see that there's quite a bit of wear there. Um, and also the stainless steel clasps. This is what I often see with partials. The clasps are just not doing anything because where they were placed on the teeth, they're actually not into an undercut. It's really important. Just a little undercut really helps things massively. Let's have a look at a smile though. Look at this here. Lip support, not great. It's all caved in and too far back. So the upper teeth have been arranged over the ridge there. So it's not looking great. So there's various improvements you can make. Better lip support, better tooth position. So that's great. So now what is super important with these patients is a wish list. I want to know exactly what they're wanting right at the beginning and whether I can address them. So she wants better fitting dentures. I can definitely do that. she wanted better looking dentures. We can definitely do that. And she also wanted the infection sorted out with the teeth and the bridge. So let's have a look at the x-rays of that just in a minute. I'll just walk you through that. So this is the bridge there in the denture situation. The flange, it must have broken off just on that area there. Denture hygiene's not great. And that's the upper arch here. So, and then the lower arch there. So let's have a look at the x-ray pictures. I think this is super important here. So this is that back tooth there. This is what we call it the 7 in the UK. So that's 4-7 in Europe. And you can see there's caries under that, isn't there? This is really not a great tooth to keep. However, this one here, the number 6, looks pretty good. It's really like a crown. And that's supporting this whole bridge, this double cantilevered thing. This root here is not doing well. It's there. We can see there's a little, we've got area on that tooth there, and also areas on these two roots there. So it's pretty sort of, in my mind, I was thinking, let's section that. We'll keep this, section that, and then take out these roots at the front there too. You can see them from above there. So yeah, get rid of that canine, these two roots there, and just preserve that tooth just here. I really, theoretically, it'd be wonderful having another tooth just there, but this is just carious and not great condition, so I just don't think it's worth even attempting. If I did have a magic wand, the ideal restoration, I think, in the lower here would be an implant just there and an implant there, and also just retain that tooth there, because these two implants here are just going to would be fantastic for stability for a lower denture, but this was not what she wanted. So here's my treatment plan here. So my treatment plan, I'd make a new upper metal-based complete denture. And the reason I wanted to do a metal-based denture is I think she's quite heavy on her teeth. There's quite a bit of wear there, and that just eliminates the potential for breaking. Plus, I'm still keeping that lower molar, so she'll still have quite good bite forces on that upper denture. Get rid of the roots and that carious back tooth there. Provide a Mark 1, a temporary lower acrylic-based denture. Wait 9 to 12 months and then fit the Mark 2 lower metal-based denture as well. So the Mark 2 denture, the metal-based denture that I was thinking of doing was going to be one like this with a ring on it. Here, metal-based, so it just sits over that tooth and has a little clasp on it there. So that was my initial thoughts. Now, during the process of the treatment, and once we'd stripped everything down and provided the immediate denture, I felt that a gasket denture would do the trick. I'll talk about that in a minute because gaskets are fantastic. So here we go. I want to do a primary impression for the lower denture and upper definitive denture. So this is my lower primary impression. And we've got the bridge on this side here, so I'm going to use compound just to get this lovely. And I love using compound in these saddle areas. It's beautiful. Mary, lift up your tongue and let it relax. Brill. Thank you very much. So just push that in, just let it set, and it just forms this lovely shape here. So, and I'm going to be using this I'm going to make a primary impression, and then I'll do a working impression as well after this, because it's such a big saddle. I think doing a working impression with a special tray will produce a great result for her. So I'm going to put adhesive on here, just paint that on. Make sure I paint it all over the compound that I put on. I think this is super important, getting plenty of adhesive. And then here's my primary impression. I've got some runny alginate in here. I'm going to squirt that
Superb.
into the sulcus. I
You're
love it.
doing beautifully. Just let everything relax. That's fantastic. Mary, lovely. Super good.
So that's all into the sulcus. This is Alginoplast by Kulzer. Beautiful stuff. And then I fill the tray with Dentsply Blueprint alginate and then rotate that in too.
And you lift up your tongue, please, and let it relax. You can bob those out, Claire. I'm going to just gently push down like this. That's fantastic. And Mary, you can just close a little bit just to relax your mouth, that's all. And then I want to just ever so gently just feed the.
So just feed that alginate into the sulcus. And so that combination of the compound supporting this area and then my alginates over the top, it just gives a beautiful impression on which I can then make a special tray. It's lovely. So it produces a working cast there. This is my upper impression here. This is in alginate here, there, and I do that in the same process, just using the two different alginates, squirt it up into the sulcus. Now, if you really look here, if you notice, I've actually missed the vault of the palate here, just like that. Now, it's not majorly crucial that we're doing a special tray on top of that, but I don't like to see air blows in that area. And what I forgot to do was just to squirt in a little bit of the stuff into the vault of the palate. It's interesting. I think, having checklists are super important for these sorts of things. And, a little mini checklist to stop me from going off track is helpful. But this is what I do routinely is to just squirt a little bit into the vault of the palate before I actually do the impression, and that just avoids that little airblow there. Because I think technicians love it when they get, really good impression back like that too. Let's have a look at the working impression for my upper denture. So the upper metal-based complete denture. So here we go. So I've got my special tray. I put my compound stops on the special tray and do my border moulding like that. I then put adhesive on here and put a runny mix of alginate into that, pop it into the mouth and border mold it and really border mold that beautifully, press that in so it's just seated beautifully um, onto the ridge there and do all of the different um, movements, pulling the cheek, get the patient to waggle the jaw open wide so that all of this periphery is molded to the functional depth and width for the patient. Love it. So here's my primary cast, and this is the custom tray that I used to do the working impression. This is after I've taken the impression. It's a little bit untidy. The photographs, the actual precise photographs, I actually deleted by accident. So this is the tray once it's been cleaned up afterwards. But here we are. I'll just show you what I do with this. I think what's super important when I'm doing my working impression is to border mold with Greenstick. And I love using it. Love pushing that onto the tray. This is Greenstick compound. It's warm. It's rather like Play-Doh, that children's toy. When it's softened in water, it's just beautiful. So I've put some on the lingual surface because I want to record the lingual sulcus functionally. It's gorgeous. You can see the steam rising from that water. And it's just lovely and soft. I can just push it. And then I'm going to put some on the buccal shelf. This is really key to everything. I love the buccal shelf here. So I'm going to push that green stick onto the buccal shelf. There. Lovely. Lovely and soft. Can work really nicely with it. Just pop it in the flame, back into the warm water. And then I can then take that to the mouth and then I can mold it. I'll show you the molding maneuvers just in a minute when I put the alginate in. But this, you can just see that this is just beautifully molded to the depth of the sulcus, lingually and buccally too. So I pop on my alginate adhesive there, and then I then load the tray with this will be a medium mix of alginate here. So I've loaded it here with the medium mix of alginate, and then I'll talk you through this whole process. This is a video here. So what I do is I glaze it with running cold water. This is the alginate. Dense ply blueprint. It's glazed. It's beautiful. Lovely. And that reduces the air bubbles by 50%. And then here we are. This is the spatula. I'm just going to take a little bit off with my finger and rub it into the occlusal surfaces of the teeth there. If you're doing any impressions today with alginate and you don't do this technique, just have a go with that. It's wonderful. I rotate that in. I'll ask Mary, lift up your tongue, just to get it out of the way. Lift up your tongue. Lovely. Push it down so it's seated. And then I start to board and mold the labial and buccal sulci. Beautiful. Get the tongue out. Move it from side to side. Really lift it up. Really go for it. And you can see that all of these, I want to see the polished surfaces starting to be developed in the rounded edges of the denture. Just lovely. It's gorgeous. And then I pop it out. Just gently lift it up. Just take it up there. Lift it over that old bridge. Lovely. There. So that me, I just know I'm going to get a really nicely fitting denture there. These are my working casts here. Now, another little tip, another little detail that I love doing is at the working impression appointment, sorry, the primary impression appointment, that one you've just seen me do there, I love doing a primary jaw registration. So these are wax rims that are made on the primary casts, and I trim them quickly to where I think the right vertical dimension is. It's just a very quick thing. And then I fix them together with Futar D. So these wax rims have been made, pardon me, on the primary casts. So they get fixed together. And then I pop that out. But before I pop it out, whilst it's setting, I just push in the Futar D, the bite registration material, in there like that. So what that means is we can use that wax rim and we can mount the working casts on the articulator. So this is a rough jaw registration, but it's so useful because it helps me set up the Gothic arch tracer or the central bearing apparatus, which I absolutely love for recording centric relation super accurately. Love it. So let's move on to my next visit, which is the occlusal registration for the upper definitive metal-based denture and the lower acrylic-based immediate denture. So I do my dual registration. So this is what I've got. So I've got an upper rim. This is for trimming to where I want the teeth to go. And then this here is to record centric relation. This is the central bearing apparatus. So what I do first is I trim the rim, this upper rim, and I trim it using the dentate pitcher. And interestingly, Mary wanted to copy her natural smile with this occlusal cant, where the center line is actually tilted. So we've got quite a tilt on that occlusal plane there. And you can see I've drawn the center line that, so it's not parallel to the vertical here. It's just slightly offset, so we've got a count on that. Rowan makes these wax rims really big, and I just trim them back like that. Interestingly, this is so important. Any of you that are really wanting to improve your removable pros, then trimming wax rims is the key to getting great aesthetics. So ask your technician to make a big wax rim and then just trim it back. It's so important. And getting really good at this is the key to this whole process. So this is that trimmed wax rim. And this, if you're doing a wax rim today or tomorrow for your technician, take this photograph once you've trimmed it with the patient smiling and send that through to the technician and send this through to the technician. And then your technician, like Rowan, can use that for setting up the teeth. This is just a tremendous thing. The other quick thing that I do is I do a face bow transfer on the bite block at the top there. This helps Rowan to mount this in the correct relationship on the articulator. It's wonderful. That's what it looks like there. Super easy. So at the chair side, what I do is I pop on my trimmed rim like that, and then I can then just alter the height, the vertical of my Gothic arch tracer here to the same height that I've trimmed this definitive wax rim. So let's have a look at the Gothic arch now. This one here that I've used for this patient it's made by Blue Dolphin. It's a PTC one. It's an American one with a ball bearing, and this works very nicely. I have a number in the practice. It doesn't matter what variety; they all work in just the same way. I put a China graph mark on here, and then that can be scratched out. So this goes to the mouth, and then I encourage Mary to move forwards and backwards, side to side. So, sorry, I've not been looking at the I haven't been looking at the Q&A. Sorry, Toby, what have you asked? Loving your head cam. Please remind us of the size of the syringe and do you use it all of it? Yes, the syringe is 40 milliliters, and I do use it for all my primary impressions. And Sarah said, do you do the registration using wax rims off primary or secondary casts? Yeah. So I do both, Sarah. So the primary rims are used for setting up the Gothic arch tracer, and I use wax rims on the secondary casts for prescribing the tooth positions. And then Wai Sheng Huang has asked, Doctor, in your video, you inject Futard after wax rim close. Why not inject on lower arch and then ask patient to bite? Absolutely, yeah. I get the I inject the Futard into the wax rim when they're static, because if I allow them to close, they can close really in weird positions. They can go like that or that, or any excursive positions. If I know that they're down and static, it's much more accurate. Why Sheng Huang? That's a fantastic question. It's so important that. Great. So back to the Gothic arch here.
Brilliant, Mary.
I'll show you what I do here. I'll just press the video and you can hear me talking to her.
Brilliant, Mary. Awesome. And then go forwards and back, forwards and back. Lovely.
That's brilliant. So, and then I'll pop it out. She's not used to moving a lot, but that's CR. You know, some patients don't move a lot because maybe their denture's quite unstable if they do that. So they sort of program the brain not to. But this is CR and I love it. So what I do next is I put a plastic disc over that. I stick it with wax. So that's the plastic disc. I just drip wax onto the plastic disc. The hole in the plastic disc is right bang over CR. So that's me just where I put all the wax around it like that. I then pop that back into the mouth and then ask the patient, I get Mary just to close into that plastic disc. So she's now locked in properly in 3 dimensions and nothing's going to turn. It's just totally locked. And this is back to your point about the Wai Sheng. You've asked about injecting futar in. This is really important. She's locked in this position. I can then inject my futar in that position, and I know that she's absolutely still bang on that CR position there. And so I get this back like this. It's just wonderful. That just fits into there beautifully. So this is what goes back to Rowan. He has the trimmed upper rim. That's for prescribing the tooth positions. I've got the face bow here, and that face bow will be used to remount this upper working cast, and then the CR record, central bearing apparatus, will be used to remount this one. So both these working casts get knocked off and then remounted using what I've got here. Super important, all of this detail. It's wonderful. I'll then go to a try-in. So these are the Shotlander Enigma Life teeth, which have been arranged using that photograph. You know, Rome's been brave with the tooth positions. We've got a lovely kicked out lateral here. And also this arrangement of lower teeth, I think is super important here. Not totally straight, so that they do look more like natural teeth. You can see I've got the incisal edge cant running down like that. I tried that in and the bite was bang on. Beautiful. You can see that. Love it. Look at that tooth there. Isn't that beautiful? Love it. Incisal run there. So this is a try-in which she liked. So she loved it. So we then moved on to finishing the upper and making the immediate lower there like that. This is my immediate lower. You can see the clasp on it. Lovely, accurate mounted models. It's great. So this is my definitive upper. It's a metal-based one. Shotlander Enigma Life teeth. A realistic shade. I think these were like either A3 or A3.5. Look at this. I just love that. A little bit of recession as well around it. You know, it's not the gum isn't coming down to here. It's up there. Much better. Nice metal reinforcement here too. Super strong. So this is my acrylic based lower. Now, if I was going to treat her again, Mary, I would actually do the lower immediate as a gasket denture too, because it would fit better than this rubbishy clasp. But that's just an important point. I do love gasket dentures for lowers too, and one single teeth. Anyway, let's fast forward to the extraction. So I sectioned the bridge, took out that carious back tooth. That's the back crown on that back tooth there. Sectioned this like that. So we retained this tooth. And this is a really solid, lovely crown now. I've taken these roots out. Fit the immediate denture. There we go. That's the immediate fitted. Beautiful bite on it as well because I've done the Gothic arch. And she loved it, loved the appearance of that. She did feel that the low is a little bit loose, which is fine. I relined this at 2 months, the anterior section, just put some wax on it, relined it with Eufy gel on the inside, and then just peeled off that wax there. And then I also did a lab reline at 4 months after extracting the teeth. And then after that, we then fast forward 9 months. I then started the definitive lower then. So my primary impression for the Mark II definitive metal-based denture. So because this area will have changed, this area will have changed, I actually used my old special tray, which is really good. And I did it using this is the syringe here because it's 35 milliliter actually, Toby. It's quite a big one. You can just get these off the internet. It's no problem. These, and then a thick material there, injected into the sulcus there, and that's my primary impression. Done. Now, I just want to just do a little bit of a segue into speech now, please, because she had sibilants with her S's. So when she said an S was like when 61, 62, 63, it was a little bit splashy. And this little ridge here between the metal and the acrylic was causing the problem. So I have to say, I have to be really honest with you. Phonetic speech issues is really not a problem that I experience very often. It's quite rare. But when I do, this is what I do with them. So I spray on the articulating spray, which is like arty spray or occlude, onto the surface there. And then I pop it in the mouth. And then I get the patient to count from 61, 62 up to 70. Really just go for it. So this is Mary doing that.
61, 62, 63.
64, 65, 66, 67. And then I pop it out. And can you see where her tongue has been touching this edge just there? It's rubbed off the occlude in that area, and it's also rubbed it off here and here. So what I did was I took a burr to it. And I'm drilling away the areas that have been rubbed off where the tongue touches. So this is just giving the tongue a little bit more space here to make those S sounds there. And then I can spray some more on and just double check it. So I've got to do it again. Pops it in the mouth, and now do 61, 62, 63, and there's less touching at the front here and less sibilants. So I then polish the denture up here, but I'm always a little bit, it makes it messy here, doesn't it? That just doesn't look quite as good. So what I've found, and this is the system I have changed, and I'm always, I think, I think that having a growth mindset and not being fixed and rigid is just so important in dentistry when we're dealing with humans. I'm not wedded to a particular technique. If I don't think it works, I change it. I'm 55 now, and I'm still finding new stuff each day. And I learn so much from you guys and people I teach, people I mentor. You all help me with these sorts of things, and I learn from Rowan and from the patients too. It's wonderful. So this is what I've switched to now. The metal reinforcement is like this. On the inside, we've got metal that fits against the pallet. And then on this here has bubble and bead here, so the acrylic can be laid on there. So if I do have speech issues, I can just drill away at this, and it's a smoother surface there like that. So, however, I don't. Or sometimes patients do want to have a metal palate like that because it's quite nice then feeling the heat of food and tea and coffee getting conducted to the palate. So it's a conversation that I have with the patient that if you have this, it may be may have speech issues potentially, but you'll get it's pros and cons for everything, isn't it? I did a copy of this here so that Rowan can then make the new lower against the shape of the new upper. So let's fast forward to the Mark II definitive metal-based denture here like that. There, so this is what I had for the working impression. So I've got my primary rim, I've got my lower tray, and also interestingly, she'd gone through a bit of stress and she'd developed a little bit of TMJ pain. So I got Rowan to make me a 3mm soft splint to fit over the upper denture. So this is my lower custom tray. Let's go to the appointment. I do my primary jaw registration against the new upper. This is to help me to get the Gothic arch ready, the central bearing apparatus ready for next visit. There, so just do that, inject it in, just like Y Sheng you've asked about, inject it in. And then I do my working impression. Greenstick, border moulding with alginate in there. Love this, it's fantastic. Nice medium mix of blueprint in there like that. Glaze it, take it to the mouth, do my border moulding. I want this side here just to look like a complete denture. It's beautiful. So that's my impression ready for Rowan. That's my jaw registration. It's going to help mount the working cast against the upper. I also did a copy of the lower two because she liked the tooth arrangement of the lowers, and I like the tooth arrangement too. So that's going to enable Rowan to make Mark II similar to the upper. I fitted the upper soft splint. I don't want to go into massive details about TMJ, pain dysfunction syndrome, but these are the instructions that I gave her. I fitted the splint, and then just to go through that, this is very, very lovely conservative technique. But I do want to highlight number 5 here. You know, as humans, we do have stress, don't we, in our lives? And often it's manifested with different symptoms, and sore TMJ is part of this. So, and it really helped. It really worked that for her. It was lovely. So denture patients do get the TMJ as well. It's rare, but they do. Let's fast forward to the occlusal registration for Mark II lower. Hold on, Gian Morrow, you've asked about why not a palatal mesh framework and why metal plates. So Gian Morrow has asked about why don't I do a metal mesh framework rather than a plate as well? I'll just have a look at that and just talk through that too. So you're dead right, Jan, and it's all about space. So if I do have space in here, then a mesh is useful as well. So in some circumstances that works nicely. But Jan, when I do a mesh, I always think about it, and I want it to be T-shaped and solid, not like that little coat hanger or little rubbishy wire that is often inserted to strengthen things. So a good solid mesh is really useful too. So good, very good point. Thank you about that. So let's fast forward to the Gothic arch for the new lower. So here's the Gothic arch tracer ready. It goes on the working cast. Rowan makes me a little plate that fits onto the upper denture because we're going to make the new lower denture against the upper denture. So this is it in the mouth. And then I get to move around. And she makes this mark here, like that. That's CR. I stick on my disc, pop it in the mouth, and it locks in beautifully. It's superb. That's really good. Locks into that plate, squirting my Futard D, and there we've got the jaw registration at the vertical that I'm wanting to restore the patient. So the central bearing apparatus mounts the upper and lower cast like that. And then I can then move on to a try-in. So this is the try-in of the gasket denture. Notice the extension of the denture. If this tooth fails in the future, which they can, we can then convert that into a complete denture like that. So I can take this to a try-in, pop it in. I just want to make sure the bite's really good. Bang on. And she loved it. I loved it. So then we went to finish. So this is the gasket denture. If any of you have not done one of these, I just really think they are wonderful for lone standing teeth when we've got enough space. So this was my original design. It was going to be a ring rest with metal reinforcement all the way around with a clasp on the side. But instead, because we've got space and I was able to drill away this lingual surface of the crown, just take it into the metal of the porcelain bonded crown, it meant that Rowan had space for the metal and the acrylic there. So on here and here. So, and then Rowan puts in this stuff here. This is back to your question, Colin. You're talking about this is the material, retention sill. And I get Rowan to put this, he puts this in when he makes the denture. So he finishes the denture and then puts this in and fits it onto the working cast. And this is like an O-ring that fits over that back tooth. It's beautiful. So we've got this O-ring that just goes in to the undercut here. It doesn't go right down to the edge of the tooth at the bottom where it fits into where the tooth emerges from the gum. It just goes in 1 millimeter into that undercut. If it ever needs replacing, Colin, this stuff, then I just send that back to Rowan and then he redoes it. But I have to be truthful about this. It doesn't require renewing very often. Over the past 18 years of having the practice, I've renewed it once for someone. And I've done at least 20 of these. And what I find is the patient's neuromuscular control takes over. So if they come in for a review 1 year down the line, this here looks a little bit tatty, but I don't bother replacing it because they have no issues with retention. Bryn, hi, morning, Bryn. This is awesome. It's super interesting that it seems the second Gothic arch is much better defined than the first one, likely showing that with the new complete upper and immediate denture, she had more freedom as they were immediately more stable. So that's really, you're absolutely dead right there. She can go that way and that way much better than that little tiny crow's foot that she did. So yeah, you're right, her articulation is improved with the immediate denture that she's been wearing. So it's super cool. Let's go back to Gothic. Let's go back to the finished denture. So Colin, these very, very rarely need replacing, but as long as we've got the working cast like that, left, then it can be done quite easily. It covers the tooth completely at the back there. It's got a ring rest on it for great support. Wonderful shape to this. It's just like a complete denture. Beautiful. Border molded. And it fits like a dream, this. It's just lovely. So let's fit it. So here we go. Fitting. Just goes over and I just push it down. Now, these don't grip massively. There is a little bit of grip there, but they are lovely. But as you can see, it's key. The bite's crucial with this, and this is where the Gothic arch is just so important. And also the border molding to get it to fit in really, really nicely there too. So Danny, great case, love the O-ring, heading off to work, but we'll look up the replay video. Yes, this is all recorded afterwards. See you in Milan. So that's great. Thanks, Danny. So then next, the occlusion that I'm looking for is this. So when I've fitted it and that the bite feels nice and even, I just double check this, and it's really important that the upper and lower front teeth don't bite together in CR. I don't want the upper and lower front teeth touching, and it did do a little bit. It still gripped it a bit at the front there. So what I did was just take it out and adjusted. Can you see where it's touching the front there? I want to have freedom in centric, so the patient can slide forward with no contact there. And then I can just pop it back in. And it's lovely. So this is the finished denture there in place. So no contact on the front teeth, canine to canine. Positive contact here at the back. Positive contact here on the premolars. The 4 and the 5, mesial of the 6. Positive contact, 4, 5, and on that back tooth there too. Also, let's have a look at difference in face shape. Can you see how it's only subtle, supports much better? I brought the teeth further out. Can you see she's got a better vermilion border just there? More lifelike. Much better. Nicer lip support. Sometimes, though, bringing them further forward like that, when they do smile, does make that groove a little bit deeper, just underneath the base of the nose, but that's just normal. They're lovely. And I think the key to these sorts of cases is getting wonderful tooth positions. And key to is just these wonderful photos. I love it. It's really, really good. So we brought the teeth out and up a little bit, just nicer. Lip support, better. That's great. So thanks very much indeed for listening. This is all recorded. I'll pop it on YouTube just now. If you've got any questions, just stick them in. I'll just do a little post amble. I run these courses here. My next course is at the end of November. I'm doing partials. I do have some spaces. We've got 5 people on that now at the moment, so we've got a couple of spaces there. But 5 is a lovely number because we can really drill into it. It's wonderful. And I use Angela here, and we take her from start to finish with her partial dentures. It's 2 days, super intense. It's mad. It's really good. And then these are my my courses next year at the practice. So I'm running 7, which covers all different types of dentures there. bookings available for all of them. I'm also speaking at different places as well too. So I will be, my next speaking engagement is next month in Holland. I'm going to be in Amsterdam at their Implant Society. So I'm looking forward to that. There, very much can't wait. And then I'm in America in Arizona in January. And then I'm going to be doing a full day. This is a full day in Texas here, and Rowan's coming with me to that. So if you're in North America, and fancy meeting Rowan as well as me, because we'll be bringing some technical work over with us, come to this meeting, just take a screenshot of that. I'm also doing 2 full days on Finn's failures. Now, this is going to be cases that really did not go well, and I had to really dig myself out of them. There'll be one fixed restoration case that I'll be showing, because that fixed restoration case was the reason why I stopped doing fixed and just totally moved on to removables. But there's lots of other removable cases that didn't work out too. Another thing that, if you really, really want to learn this, then the best thing to do is to go on my courses to start off with. Once you've done my courses, start doing mentor training. This is when people really go to another level, just like Bryn does. Bryn, who's just joined us this morning, and I've lots of other people. Lila over in Cork, and there's Curum in Scotland, John in America. Loads of people have done this, and it's just a wonderful thing. And I get to know you better, and it's just fantastic. So, mentoring here is wonderful. Love it. There, sorry, I was talking about this on that particular slide. I do love speaking to different groups as well. So if you've got people, if you've got an association you'd like me to speak to, then I'd love to do that. So, and also if you want to just come and chat to me, I'm going to be at these 2 meetings here next year just as a delegate. And I love this. This is like ultra high end, mainly fixed work. I'm trying to get a bit more removable involved in that there, but this is fabulous. This is in Barcelona. And if you're part of the International College of Dentists and in that group there, come and say hi to me in Milan, because I'm going to be there too, just like Danny said there. So that's great. Anyway, thanks very, very much for listening, all of you, and I'll see you next month. I'm going to do this is early in December. We'll do one next month there. So have a great rest of the month, and this is recorded. Bye for now. Cheers.